copy should be bold and loud. So people should know straightforward that this is an action that they're going to. It should be announcement, action, the day of the week it's going to be, in all bold. And I like to, in the copy, also say the date, day, time. And if it's a digital action, which sometimes happens in COVID era, you could say the geographic time zone, location, and other safety details. So more and more, as we're seeing with our recent waves of protests for Black Lives Matter and other health justice related issues, we want to ensure safety at those different spaces. So ensuring mask wearing, distancing, sanitizer, anything that will help ensure a safe space. And then also make sure to tag all organizations associated with the action. And even if they're not associated, which is either a co-sponsor or speakers or other related people that will be involved in that action, it's even helpful to tag people with larger platforms. So whether it's one of the larger HIV orgs or health justice organizations, it's helpful to just tag them along or CC them so that they're aware and maybe help amplify. And then third, or rather fourth, is add a compelling image or a graphic to attract people to come. And basically if you don't have someone who could do any type of minimal graphic design, you could always just use an image. But I think it's helpful if that graphic also has all the useful info, such as date, day, time, and any other useful information so that someone could save it if they feel encouraged to share it themselves. That's an easy way to go about things. So that's kind of some precursors on kind of a before action when you're trying to mobilize people to come. All right, so here are some examples. One is for, basically in New York, we have an Out of Darkness event. This year it was at the AIDS Memorial, so basically tagging the organization or location. And then a Facebook event, if you have a Facebook event, that's always useful as well. And then if you see on the bottom, all the different publications, media, and people to flag it to. And it's always useful to tag media as well in case you want some media involvement or coverage for the event. So yeah, these are just kind of two separate examples that, both give a representation of how to really publicize an action online, and specifically Twitter. All right, next. And these are some kind of useful areas for when you're documenting actions. And again, these are all things not just for an organization, but also if you're just an organizer and documenting and want people to notice, what's happening on the ground. So when documenting actions, be mindful of the following. So to capture captivating and meaningful content, both in photo and film, to be mindful of not catching people's faces. This has kind of been a recent tip for what I've seen for people to be thoughtful of police and state surveillance. So just in case you see someone doing something that might not be protocol of that action, and you might have them on film that might be incriminating evidence for future things for that person. So it's just to be mindful of safety of everyone that you're filming or taking photo of. To quote snippets of speeches and chants so people could follow along with photo and video. And this is both with the video content and also with the copy. So this is helpful for the hearing impaired and also just helpful for people to follow along, because when you're filming, you might not hear exactly what people are saying, but you still want to capture that. Fourth is to tag speakers and orgs who you capture, even if the speaker does not have a social media handle or the organization doesn't. It's always, helpful to say their names and who they're representing. And then the last thing is using that actions, or if there isn't an action hashtag, just a hashtag so that people could follow and click through. And this is a good way to mobilize, you know, retweets, likes, and everything that will help get that post attention. And here's two examples. One is from the Queer Liberation March, and this was actually the first Queer Liberation March that ever happened. For those that don't know, the Queer Liberation March was an action in opposition of the big New York City Pride Parade for a cop-free and corporation-free event or protest. And basically this die-in was representing 17 HIV positive asylum seekers that died in ICE detention. And die-ins are typical for ACT UP actions and are used in the future for anyone who experiences neglect, violence, and fall victim because of negligence or inaction. And then the second is from a recent protest we had with March for the Dead. And this was an action to commemorate the over 200,000 lives that were lost due to inaction and negligence. So these are some examples. One on the left is a video, and then the right is some photos. And some of them are banners, some are some actual like numbers and photos. And yeah, those are just, you know, two examples of how you could utilize photo and video to capture on the ground protests. And then the next, people resonate with emotionally driven content. So here is a Real Housewives who is throwing a table. So, and a lot of times when we think of emotionally driven content, some of them could be really polarizing and controversial. And these two are actually examples of that. So both are COVID related, but you know, the one on the left could be anything related. But these are two examples of how we utilize social media to mobilize outrage and anger and rage and all those emotions that we want people to resonate with and feel connected to. The one on the left is a really familiar image to a lot of public health advocates, Silence Equals Death, which is from the Silence Equals Death Collective. And a lot of veterans kind of readjusted that image to Trump equals death for the climbing numbers of COVID-related deaths. And at that time, it was 5,794 deaths. And now, as we know, we're almost at 215,000. And on the right, this was an image that was created thanks to a collaboration we did with Housing Works. And it was to commemorate a David Wojnarowicz jacket. And it says, "If I die of COVID-19, forget burial, drop my body on the steps of Mar-a-Lago." And both, you know, did create some activity. And I think because of that, those polarizing and really outrageous imagery, we got a lot of traction because of that. And I think that's what, when you think about how do you maximize your presence on social media, think of really polarizing, emotionally driven related content. Next, you can think about what's trending, like find ways your work and campaigns could tap into national trending topics. And this is kind of like a really unconventional way to do things, because you think of the Oscars, you think of a live telecast, and you say, like, how does this relate to the work I'm doing? But in the year of Bohemian Rhapsody and the year of Rent Live, which were both pieces of art that had to do with HIV/AIDS, ACT UP thought that this was a way to connect to viewers and to talk about the issues that we're facing today, especially because a lot of historical references of AIDS are mostly of memorialized nature. They don't talk about what's happening today. So for instance, on the left, we said, let us remind you that Freddie Mercury died of AIDS and that the fight to end it still continues. That Rami Malek failed to mention that in his speech. So things like this and things like Matthew McConaughey and Dallas Buyers Club, we're finding ways to engage in these large-scale award show ceremonies when the art relates to AIDS, and there's absolutely no mention of that. And on the right, as we know, the musical Rent, which also, has the ACT UP chant in the musical, we discuss how Gilead Sciences, one of the largest pharmaceutical giants for HIV treatment and prevention drugs, had an ad for Rent. So we found that was a really hypocritical thing of the telecasters to do, to platform this large pharma giant. And we decided to get in the faces of the viewers and say, see that commercial you just saw? This is what's actually happening. So we talked about how PrEP was $1,600 a month, and we plugged in a national campaign for it. Next, finding ways to connect with your past. So I'm trying to make this, fun. So a lot of your organizations, I'm sure, have a past and a history. Jason mentioned how Health Gap was created in 1999. ACT UP was created in 1987. So there's a lot of connections that we can make with what's going on in our current sphere of politics and then what was happening before. So both of these posts, for instance, have connections to Trump. One was his way of stigmatizing and scapegoating COVID. I'm not going to say it because I think it's really dangerous, but you could read it. And we kind of responded to that and said, we remember a time where HIV/AIDS was called the gay-related immune deficiency, or GRID, or gay cancer. So we're not letting our leaders, our media dictate stigma. And then the right, we kind of commemorated a really famous action that we had in 1989, for Donald Trump, when he kind of went through city funding for a tax abatement. And we related his recent news. The New York Times leaked for how much he paid for taxes. And I think when we relate our history to our present, we find, obviously, history repeats itself. And I'm sure with our work, it always does, because as we see, some of the origins of HIV justice work began with fighting pharma, and it still continues with fighting pharma. So we'll always find that connection, unfortunately, but it'll always kind of empower us to keep moving. Next. So the naysayers, the clapbacks, and combating misinformation. Basically, what I like to think about with social media is that people are always looking for that next thing to say, whether it's in opposition of something we hate or something that we see that's wrong. And I think with, especially relating to public health and relating to global public health, it's actually important to respond to misinformation, to respond to anything we see that is wrong on social media, especially as HIV/AIDS work like Health Gap and ACT UP, we see a lot of misinformation about transmission. So even today, we see some tweets that misconstrue that you could seroconvert from spit, or so many different things. So I think it's up to us, even in the 4th decade of the epidemic, to combat that misinformation. So here's some examples. One is Trump on a national press conference saying that there's an AIDS vaccine. And as we know, there's no AIDS vaccine. So that was our chance to remind the public that an AIDS vaccine does not exist. And I said that twice, so sorry about that. And I think second is our response to Mike Pence for a World AIDS Day post. And that response to him was basically reminding the public of how he caused the largest US HIV outbreak in history. So kind of he doesn't really have any place to have a World AIDS Day post. So that's that. And basically some quick takeaways. Remember to be personable with the account. I think people relate to content that they can feel something with. Second is to create posts that people, again, resonate with, that feel like in the third, say that we're able to retweet, repost. And I think what I try to do with the ACT UP account is to kind of make us sound like a friend or a comrade, that we're just talking to you as an individual, and we're finding ways to engage with you and relate, and then always keep in tune with things around the world. So always look for trending topics, always look at other accounts and kind of see how they're tapped into different conversations, and just to always have fun with it, that people will gravitate to accounts that they see are having fun with things. So even if it's, a little clapback or something that generally the account or people disagree with, I think people will, have fun with it and retweet and repost. And that's kind of how you grow trust with people online, and that's how you grow numbers and as a result. So yeah, that's kind of some quick tips, some different takeaways, and those are just some visual ideas and some things that I've learned. But if there's any questions, I haven't seen anything in the chat yet, but I could kind of close the screen and we could kind of have an informal discussion on kind of things that I brought up and things maybe that I missed.
Yeah, who has questions for Jason? Yes, Tiffany appreciates your excellent GIF usage, Jason.
Thank you.
Yeah, the two things really resonate. I mean, a lot resonated with me, but looking back at history for these organizations that have been around a long time. I've been volunteering with Health Gap for 20 years, so I've seen a lot of history there. So, but to think about like what's there that you can sort of resurrect to compare to today is really helpful. And then the other point in the last slide, I think, about being personable. One of the things that I think activists bring to the table that's kind of rare in the world is, authenticity, and really trying to find a message that's, truthful, on point, brave to be said, and, really just, try to go there. That's kind of what, most people kind of don't do in the world, but activists are like willing to do that and risk that. And I think it's really important to be authentic about where you're coming from personally and really just speak the truth. So really powerful things.
Yeah, thanks, Richard. I think like all the energy that you would find in a protest or direct action or some on the ground work, like all the energy that you feel at those actions should be something that you try to share year round. So people feel that connection and obligation to do it. So everything, even if it isn't a direct call to action, should be a call to action. And I think something before, like you said, with relating to your past, I think a lot of useful things is just to have a timeline of what happened on this day at this organization. So on this day, on March 2nd, we had this action. And I think when people are reminded of that history, they'll find that connection. They'll find ways to force its relevancy, and therefore it'll keep reminding people that the work is still not over. So Richard Stern said in the chat, still here in Central America, 30 to 40% of people living with HIV don't have access to internet. In poorest communities, rural areas, and indigenous communities. A tough challenge to overcome. Also, most early ACT UP work and treatment access advocacy was done when the internet was barely existed. That's definitely a really great point. We have to be mindful of access and, you know, even just the general use of these social media is a privilege. So how we can even elevate the people who are doing great work in Central America, for instance, and amplify their work and their mission.
Yeah, I think an important add-on to what Richard is saying is that I think a lot of times that digital, using our social media and digital platforms to amplify our in-person actions, or like as a way to supplement, it certainly doesn't take the place of like an in-person 200-person action, right? But it's a different tool for us to have access to amplify those and to exist in an additional space.
Yeah, I think that's something I mean that I left out in our presentation is that even though it never eliminates the tools that we need for in-person action, it definitely can enact some change. So when I think about some of the things that we were able to do with the ACT UP account was a recent Nike campaign used and the Silence Equals Death triangle, and we kind of called them out on it online. And because of that mobilized online digital work, we were able to get a lot of grants for different organizations such as Vocal, ACT UP, and New Alternatives. So I think there is some ability to enact some change with digital organizing as well.
I would, excuse me, I would say that, for example, I'm using Central America as an example. In Guatemala, 25 to 40% of the population living with HIV has no access to medications, and they live in poor urban communities. And the current network of activists, which is funded by UNAIDS and World Health Organization, doesn't even make an attempt to reach out to these people who are considered practically to be expendable. They're not part of NGOs. They don't even know what the HIV NGOs are. And unfortunately, COVID makes it even more difficult to reach out to them. But the establishment HIV hierarchy, even the Global Fund to a certain extent, is ignoring populations that don't have access to treatment. And that correlates definitely to extreme poverty, not just poverty, but extreme poverty, rural areas where indigenous populations live, and people who are just geographically isolated in general. And there's a certain, if I may use the word, arrogance in some of the NGOs that, okay, we take care of our own, and these people, if they wanna find out about how to get treatment, they should come to our meetings. Well, these people never even hear about the NGOs and have no access to being able to come to the meetings, let alone, as I previously mentioned, they have no access to internet, and they're just kind of, they show up at healthcare clinics in Guatemala City when they're already very sick with HIV, and when treatment is, it may be too late to even initiate treatment and have it to be effective. Okay.
Yeah, thanks for sharing that, Richard. I think that, like, so one of my questions is like, how do we, again, like, I think social media is not like the be all end all of activist tools, right? It's one of the tools that we have in our tool belt. And I think that my question is like, how can we, this speaks to like, how do we center our campaigns on people who really, or not on people, but like on situations like that, on situations where everyone, no matter, like, even like you said, like the very poor, like how do we center it on making sure that people in that situation do get access to treatment, right? I don't know if like we fix that with social media, right? But we build campaigns to make sure that people like that are included.
Well, you can use social media to publicize and draw attention to what you find out. But one of the things that I found was very useful in my work in Central America and in the region was actually going to the hospital to visit people in the hospital who were sick and not receiving either antiretroviral medications or medications for opportunistic infections, as they were known. And that you couldn't really do it without going face to face to meet with people and see what was really happening, because there was no other way to focus on it. I mean, you could go to outpatient clinics too, and if you had sympathetic directors of the outpatient clinics, they might give you the statistics on how many of the clients had died in their area. But it's very difficult, and COVID has made it even more difficult. But again, what always bothered me for the last 5 or 10 years is that UNAIDS and the so-called leaders and the country coordinating mechanisms of the Global Fund, they just sort of leave that out of their agenda. It's too much work, and it's not fun and sexy to go visit hospitals in poor neighborhoods and clinics. And so that population, one way or another, is just left alone. To what extent that applies to the US, I have no idea, but I suspect in poor neighborhoods, things don't go as well as they should either.
Yeah, and I think a useful tip for social media as well, especially when it relates to low income and poor communities, is the use of social media's involvement of mutual aid work. So whether it's not our big UNAIDS, I think our grassroots organizations are kind of spearheading that, especially with COVID, on social media, whether it's GoFundMe's or sharing the Cash Apps or Venmos of people who are in dire need of either healthcare or necessities, whether it's food or housing. So I think social media does make some pathways to reaching those populations in some way, but obviously it doesn't help everything.
Another point I would make is, and social media can help, is you need to document what you observe in the field or in any context. Going to a clinic, okay, there were 7 people there and 3 of them said that they hadn't been seen ever by a doctor, and they had no CD4 or viral load tests, etc. But document it and send it to decision makers and send it to as many people as you can. And the internet is extremely useful for that, even if the people affected can't articulate their own situation because of the limits we've been talking about.
Awesome. Well, thank you for sharing, Richard. I think we have some few other questions in the chat. So Niv asks, do you make an effort to reach out to younger people on social media and act up TikTok or Twitch account? So we haven't really breached the TikTok sphere yet, but we actually use Twitch for a drag show that we do, and we're having our third one this weekend, I believe. So it's on social media. I forget the exact date and time, but it's all there. So that's our kind of first plantings of plugging into the Gen Zs of the onlines. So we're using sort of Twitch, but not yet TikTok, but that's definitely something that we should start doing. And then Tiffany asks, are there any additional strategies in creating social media campaigns that reach outside of a progressive bubble? That's actually a really great question, because I think that's one of the hardest things, because I think the way to reach people outside of a progressive bubble are mostly direct conversation and town halls that are open to all. I think a public account is often, really hard to reach people that aren't on your side of the aisle. So I personally find that difficult, but I don't know if anyone else has anything to add about that.
No, it's hard. I have sort of a basic question. Like, I know that there is some like rules of thumb around how much you should post like per day in order to like get your account to be more trafficked. Like, is there is there a number to that? Like, is that a real thing?
I think that people should just keep posting and not really, I think definitely it should be every day, but I think it actually should be more than every day, because I think with the algorithms of how a day-to-day works, like a lot could happen obviously in 24 hours. So we'll be talking about Trump's taxes in the morning, and then we'll be talking about a totally separate issue in the evening, especially if there's like an award show or there's something, a show that's happening. So I think there's always ways to engage, and there's always time to post. So I think the more the merrier, and that's a great way to build content and a great way to build a following.
Thanks.
So can you I know that we talked a lot about like how to use our platform to like push for like actions and events and like to document. Can you talk a little bit more about like how you use it to build community with kind of like activists as well? And like how like, yeah, what that looks like for folks to like, sometimes it could be about actions and events and like pushing an issue, but then oftentimes it could be about building community with folks who are working on similar issues or share the same values. Like,
Yeah,
how
definitely.
do you find them, right? You know what I'm saying? How do you find them?
Yeah, I mean, especially when a lot of issues cross geographic location, like how do you build community on an online sphere when someone's in New York and then someone else is in LA or Sudan, etc. So how do we do that? I think it's always helpful to make sure that you're on top of your direct messages, that if people reach out, always be attentive to like respond, because people love to be answered and be talked to, especially if they're in a remote location and they don't have access to in-person community. That if they could find some online community, that's always a useful way. and also respond publicly. If people like everything that people are mentioning, if you don't agree with it, don't like it. But if you do, that's always a great affirming way to pay attention to people, and to keep sharing people's tools. That if you find a tweet that resonates with you or the organization that you're running the account for, retweet it and or quote tweet it. If there's a thread that you really think is useful for people, quote tweet it and say this is a useful thread. So there's like definitely ways to share resources, tools, and you use them to build community. And also like articles. So especially because a lot of the issues that we discuss are not always on a national platform. They're not always going to be at the next debate, or they're not going to really make their headway. Like, it's up to us to really push for those topics to be discussed, especially with the hashtag. So if there was the hashtag VP debate, we didn't hear one question about HIV. So how do we engage with a lot of the national conversations and pushing it for online conversation?
Anyone else have any additional questions or comments for J-Ro? What do you,
Well,
oh, I'm sorry, yes.
I was going to mention that about 30% of the session is kind of Greek to me. I'm fluent in Facebook and I know something about Twitter, but hashtags and and algorithms and other things are terms that I hear bandied about, and I suspect that many people who are well-meaning activists with lots of abilities could use additional training about the things that you're referring to, because the talk that you're giving is undoubtedly full of useful tools that I wouldn't necessarily know how to apply, and I suspect, and that applies also more to developed people in developing countries perhaps, or people who are just not tech savvy. So maybe Health Gap could organize some kind of internet training, but focusing specifically on concrete tools and how to use them.
That's a great suggestion.
Yeah, I think definitely, social media 101s are definitely helpful for everyone who's just starting to use social media as a way of digital organizing, or just tools that you could use every day. So yeah. And Niv also asks, have you all tried to draw parallels with COVID in your public messaging? Has that been effective? Or has that been? Yeah. So definitely ACT UP has been involved in ways to relate HIV and COVID. Some have involved PharmaGreed, that's in vaccine access, and that relates to even to the specificness of Gilead Sciences remdesivir costing an astronomical price, and we see how that correlates with HIV. There's really so many ways that you could draw those parallels, and we've tried to name them also with policing and criminalization, whether it's countries or states. We've related the ongoing HIV criminalization and the relationship to the kind of fresher COVID criminalization as ways that public criminalization is never a great public health intervention. It's ineffective. It burdens our marginalized communities, and it's just a plane ride doesn't work. So that's another tool that we've used, and we've kind of coalesced with other national and international orgs such as HIV Justice Net, Positive Women's Network, and other orgs that we build community with around criminalization. And obviously others as well include communities affected, mostly Black and Brown communities, and are affected by both HIV and COVID, and also population. So our prison population, our detention center population, and our shelter system population. So I think there's so many ways that we could draw those parallels, and those parallels just keep coming as we kind of expose some of the systems that are in place. And I think that as we talk about global public health, there's always, unfortunately, ways that we could draw messaging and relationships to different diseases and different types of stigmas, et cetera.
Yeah, I think too, like we have to be drawing conclusions right now especially between HIV and COVID, when we look at, especially thinking about like access to medicines, right? And we think about how they're trying, like all these different drug companies right now are contributing to ways to make a COVID vaccine, and they're doing the same things that they were doing for HIV treatment, right? They're like using taxpayer money to fund the research, and then they take the product and they charge you $3,000 for it. So it's paying twice, right? So it's things like as basic as making that connection, but also like Jason said, criminalization and people in prisons being at much higher risk to both HIV and COVID. Like there are endless ways to draw parallels between COVID and HIV.
Massive government failure, exactly. Inaction, negligence, that is basically the magnifying example of it all. And I see that Teresa also mentioned, how do you personally safeguard from social media burnout? I personally deal with a lot of social media burnout, and especially when you're doing in-person organizing and digital organizing, it could be very taxing emotionally, especially when you're really ingrained in the work. But it's always helpful to take a step back. If it's your personal account, put it on lock, just take a step away, delete the app. Just find ways to disassociate so that you could rebuild, refresh, and you know, you're not useful if your mental health isn't in good shape. So that's kind of what I found is best. I'm personally taking a break right now, so yeah.
It's a great question. It's really real.
Any other questions that's on people's mind?
Well, Deborah said earlier that she, wants another series of these things. So if people feel there's other stuff they want to learn about, reach out to Emily and Jason and send in your ideas, and we'll see about something in the future.
Yes, this is definitely not the last time we'll do something like this, and Jason and I, if we haven't yet, we'll be reaching out this week about chatting more about what comes next after this training series, because this is just getting started.
Thank you, Jason, for such an amazing presentation and your expertise. Thank you all for being here. And yeah.
Thanks, everybody.
Thanks so much, Emily and Jason. Thanks to everyone for giving their input. It was super helpful.
We'll have videos up sometime no later than Thursday. More than likely
Yeah.
tomorrow, but definitely no later than Thursday. Videos are up. Videos are already up. Matter of fact, I can see if I can put the link in the box real quick.
And once the videos are up on the website, they will live there like indefinitely. Like we have no plans to take them down. That should be a resource that people can always come back to.
Yep, I'll just drop it in the chat once I find it.
And if you don't already, go ahead and follow Health Gap on Twitter and Instagram and Facebook. You can keep up with, we've been tweeting about these trainings. We regularly share articles and info about like what's going on with global HIV and COVID and all things related. All right, cool.
Well, I don't know why I can't find anything. Yeah, we'll be sure to email it out to folks. Folks will have it.
All right. Thanks, everyone. Thanks for coming to the trainings and for coming tonight. Talk to y'all soon.
Bye, everyone.
Thanks, Jason.
Okay.
Oh.